Hi, I am Dr. Gunadhar Padhi, Senior Consultant and Coordinator, Critical Care Unit, Apollo Hospital, Navi, Mumbai. So today I am going to speak regarding the management of the burn injury. So as all of us know, burn injury usually poses a serious threat to one of the patient's life if it is not treated properly in time. So burns are nothing but it is a serious tissue damage caused by any form of hot liquid, electricity or any kind of chemicals which can usually corrosive to the tissue and cause burn injury. So the burn injury usually classified into two types, either it is a minor burn or it is a major burn. So major burns means when the burns involve the extensive area of the skin, and if the burns involve the important structure of the body like the genitalia, the oral cavity, the burns around a joint, the burns around the neck and chest where the patient cannot able to breathe, and if the patient is in shock, those are called the major burn injury. So the major burn injury, the patient has to be transferred to the hospital or the nearest burn center, and the patient needs to undergo immediate medical attention, and he has to be evaluated properly by emergency physician or the burn specialist. Whereas the minor burns, where the burn area is very small and usually the burn, when it involves the non-vital structure of the body like a superficial skin, then it is called a minor burn. So minor burn can be treated on the day care basis, or it can be treated on the it can be managed by the first aid management. So the first aid management of the minor burn involves, first thing is to remove the person from the burn area and remove the person from the smoke inhalation, and then remove all the structures like the rings, the whatever the things the patient has worn, and third thing is to expose the burn area to the running cool water for not more than 10 to 15 minutes, apply some gentle lotion and soft lotion, and fourth thing is to take some analgesics and antibiotic as per the doctor's advice. So minor burns, if it involves the children, the pediatric population, the neonate and the geriatric population, then it has to be treated like a major burns, and in those cases, ideally the burn specialist has to be involved. So what are the cases where usually we seek a severe you seek a medical attention for a burn patient? Like if the burn patient is complaining of breathing difficulties, then that patient has to be referred to the hospital. If there are burn injury around the mouth, and if the patient is in smoke inhalation, complaining of smoke inhalations, where the patient is complaining of breathing difficulties, those cases the patient has to be referred to the hospital. Any burn patient where the burn area is extensive, is more than 30%, those patient has to be immediately rushed to the casualty. If the patient with burn has a signs of severe hypotension or shock, those patients should be immediately referred to the hospital. Otherwise, the burn patient can immediately first given the first aid treatment, and then they can be called for the help, and with the ambulance they can be shifted to the nearby hospital. So my take home message is never to neglect a burn injury. A minor burn injury can sometimes lead to a serious threat to patient's life, and those cases has to be reported, and it has to be treated under the proper supervision of the medical specialist. And some of the burn cases can also be treated with proper critical care facilities where all the modalities of treatment are available. Thank you.